This Wednesday, December 1st, is World AIDS Day, a chance to raise awareness and show support for the some 38 million people worldwide who are living with HIV. Earlier this year, world leaders agreed to a goal of eradicating AIDS by 2030, but the UN warns that that deadline may not be reached due to persisting inequalities. Well, for more, we can speak to today's prospective guest, Dr. Alexandra Calmy, the head of the HIV/AIDS unit of the University Hospital of Geneva. Dr. Calmy, thank you so much for joining us today on France 24. I actually want to start with a semantics question. HIV is present across the world, yet it's still often referred to as an epidemic rather than a pandemic. Which term do you see as being more correct, and does it matter?
Yes, thank you very much. Good morning. I think it does matter indeed, because HIV/AIDS is a pandemic. It is all over the world and it touches all continents. There is no country, no place that has no HIV or AIDS. So I think the term of pandemic would be more appropriate.
If pandemic is more appropriate, why is it that we use epidemic so much more often?
Maybe it is to decrease the importance of the pandemic of HIV/AIDS. I don't exactly know. I personally do not use the terms of epidemic, except if I talk about my own country or what's happening in my own frontiers. But generally speaking, I think we should use the term pandemic for HIV/AIDS.
It's good to know going forward. Now, as I mentioned, the UN AIDS Agency has put the spotlight this year on inequalities in the fight against HIV. Can you tell us more about what some of those inequalities are?
Well, I think with COVID-19, we have been very prone to see how the vaccine inequity led to dramatic issues. And it was the same for HIV. I mean, it is indeed a challenge to bring drugs, efficient drugs, everywhere in the world, everywhere. And I think most of the inequality were first in the early years of the epidemic, that people living in some places in this world did not access the drug. Now we have really changed the rule of the commercial rules of the pharmaceutical industry, and we are able to access generic drugs, but still to bring those drugs everywhere, every time, as long as it is needed to everyone, is still a matter of inequality. But there are many others inequality. Access to treatment, access to testing, and alleviating all the obstacles to access tests and to access treatment, to access health care. If you are a migrant somewhere where you cannot access care, if you are an IV drug user and you're put in jail, then you cannot access your care. So there are many places and many ways of being unequal. And HIV has this unique way of getting where you are not expecting it. So I think it is extremely clear that inequality is just not one. There are plenty of inequalities. Just even looking at the fact that in some countries, having men who have sex with men can go in jail. So there are many ways of preventing real access to test and care for HIV-positive individuals.
Access to treatment has been expanding, but a large portion of people living with HIV, as you've been explaining, still haven't been able to get it. Why is that? Can you talk more about some of the barriers to accessing treatment?
Barriers to treatment are multiple. They can be logistical. Okay, you have to go in a place, you have to wait some time to get your drugs, access the care and access a healthcare provider, etc. You can also have more difficult barrier, but it is a treatment that you have to take every day. It's a pill that you take every day. You cannot have holiday pill. There is no way that you can stop for 3 months your pill and then restart, because you can really be very sick when you restart. So there is also the need for innovations in that regard. And I think one innovation that may help in this obstacle of accessing a long-term and durable care is maybe the long-acting drugs. And we are very looking forward to these new long-acting drugs, because we do hope it may help to overcome these obstacles that you're just mentioning.
And can you maybe talk about more developments we've been seeing, and maybe about some of your current research?
Yeah, I think the current research today are trying to improve the quality of life of the individuals affected with HIV. What everyone would like is that being with HIV or living without HIV would be no difference. But it is indeed not the case currently for many reasons. First, because of stigmatization, it is still very, very high. It is an obstacle to care as well. So stigmatization of being HIV or stigmatization of having risk factors for HIV, this is a real big obstacle. So a lot of the research we're doing now is really trying to simplify treatment, having long-acting drugs, trying to simplify also the monitoring of the drug, the frequency of this biological monitoring, and really having in mind that what would be the goal is that whether or not you're HIV positive, you are not afraid of yourself, you're not afraid of saying what you have. And this is by far not the case today in 2021, 40 years after the first AIDS case has been described.
All right, Dr. Calmy, we're going to have to leave it there, but a very positive message, not to be afraid to say that you have HIV, nothing to be ashamed of. Dr. Calmy, the head of the HIV/AIDS unit at the University Hospital of Geneva, thank you very much for speaking to us here on France 24.